May 2025. News that the famous actress Cao Ying was diagnosed with stomach cancer swept the trending topics on all major platforms. Award-winning supporting actor Liu Kai-chi also tragically passed away from this disease in 2021. It was just over 4 months from his diagnosis to his death. Data released by China's National Cancer Center shows that our country's incidence and mortality rates for stomach cancer are both the highest in the world. And the main culprit behind this is hiding inside the bodies of 700 million of our countrymen. It's called Helicobacter pylori, a Class 1 carcinogen as identified by the World Health Organization. As a type of bacteria that can survive in the highly acidic environment of the stomach, a mild infection can cause bad breath, nausea, and upper abdominal discomfort. A severe case can lead to gastritis, stomach ulcers, or even gastric perforation. About 2% of those infected will develop cancer. But don't underestimate this 2%, because the number of people infected with Helicobacter pylori is now approaching half of the world's entire population. This makes us wonder, why is the infection rate for H. pylori so high? Why do some people show symptoms while others don't? Under what circumstances do we need to eradicate it? And can it come back after it's been eradicated? In this episode, we're going to explore how Helicobacter pylori causes disease, how it spreads and the methods for screening, and how to deal with it. We hope this will be helpful to all of you. For a very long time, the medical community widely believed that the stomach was a sterile environment. Gastric acid, being a strong acid, can lower the stomach's pH level to below 2. An acidic environment like this can easily corrode flesh and bone, teeth, and even metal. It's been called a mobile incinerator with such strong corrosive power. How could any bacteria possibly survive in there? The renowned expert Schwartz even declared, "No acid, no ulcer." Under this settled conclusion, even when bacteria appeared more than once, under scientists' microscopes, everyone simply turned a blind eye. Authority leads the progress of an era, but sometimes blind faith in authority can also become a cage that holds the era back. In 1982, a defiant gastroenterologist, Barry Marshall, wanted to prove the existence of this bacterium. So he took a bacterial solution cultured from a stomach sample of a patient with gastritis and drank it all in one gulp. After enduring 10 days of vomiting, bad breath, and upper abdominal discomfort, Marshall underwent an endoscopy and discovered that his own stomach lining was indeed teeming with these curved bacteria. Because this bacterium often resides in the pylorus of the stomach, it was named Helicobacter pylori. In 2005, Marshall was awarded the Nobel Prize in Physiology or Medicine for his discovery of Helicobacter pylori and its connection to gastritis, stomach ulcers, and stomach cancer. And his bold act of experimenting on himself also earned him the fond title of the academic madman. In subsequent research, people gradually came to understand how Helicobacter pylori is able to survive in stomach acid. It's because it can secrete an enzyme called urease, which converts urea into ammonia. Anyone who took high school chemistry should know ammonia is an alkaline substance. It can neutralize the stomach acid, forming a protective shield around the Helicobacter pylori, thereby preventing it from being corroded by the acid. Absolutely ingenious. So here's the question. How did this thing manage to sneakily get inside nearly half the world's population? I'm sure many of you have memories from childhood of being fed by your parents, the experience of being fed by an elder. And when I say feeding, I don't mean the usual kind. I'm talking about when elders worried you can't chew or swallow. Use their own mouths to chew up the food first before giving it to you. This kind of love passed from mouth to mouth is one of the main ways Helicobacter pylori spreads, through oral-to-oral transmission, because children's immune systems and gastrointestinal functions are not yet fully developed. They are already a group highly susceptible to H. pylori. So if an adult infected with H. pylori pre-chews food for a child, kisses the child on the mouth, or shares eating utensils with them, it will increase the risk of infection. Most H. pylori infections occur during childhood and adolescence. Another common route of transmission is the fecal-oral route. In other words, eating poop. Now this might sound a bit unbelievable to us, but it's actually not that rare. Some infected individuals don't wash their hands after using the toilet and before eating. If they accidentally get some on their hands while wiping, and then use those hands to share utensils or food, it creates an opportunity for transmission. Also, in some areas with poorer sanitary conditions, people are used to eating, drinking, and relieving themselves all in the same river. And the best part is the raw water with red, yellow, and green things floating in it. So clean and hygienic. The probability of infection naturally increases significantly. In summary, the transmission of H. pylori is closely related to lifestyle habits and sanitary conditions. Africa has the highest infection rate, which can exceed 70%. in developed Western countries because of individual plating and better public sanitation. The infection rate is generally lower, often below 30%. So that brings us to the question, if we are infected with H. pylori, do we really need to eradicate it? To get to the bottom of this, we first need to understand how Helicobacter pylori gets away with murder inside our bodies. The reason our stomach can contain highly corrosive stomach acid is because the stomach's wall is protected by a mucus lining. The cells of this mucus lining secrete large amounts of mucus, forming a thick mucus layer. This mucus barrier, which contains bicarbonate, is the key to protecting the stomach wall from being eroded by acid. But Helicobacter pylori, using its flagella that spin constantly like propellers, is able to penetrate this thick layer of mucus. After reaching the stomach lining, the bacteria use adhesion factors on their surface to latch on tight to the epithelial cells of the lining. After that comes the real killer move. Move number 1, blowing bubbles. It secretes a toxin called VacA, which induces vacuolation in the host cells. So what's vacuolation? You can think of it as blowing a bubble inside the cell that grows uncontrollably. These bubbles continuously squeeze the living space of the organelles, destroying the cell's structure and function, and can ultimately lead to cell degeneration and death. H. pylori's second killer move is getting someone else to do its dirty work. It injects a protein toxin called CagA into the cell. This toxin induces the epithelial cells to produce inflammatory mediators, which in turn promotes an inflammatory response. You see, our immune system is great in almost every way. Its only flaw is that when it gets into a killing frenzy, it slaughters everyone indiscriminately, friend or foe. You think you can handle that? Well, the stomach lining can't handle it either, which just worsens the damage. Over time, this leads to gastritis and stomach ulcers. Severe cases can lead to stomach bleeding and perforation. You think you can handle that? Well, the stomach lining can't handle it either, which just worsens the damage. Over time, this leads to gastritis and stomach ulcers. Severe cases can lead to stomach bleeding and perforation. Severe cases can lead to stomach bleeding and perforation. At the same time, CagA is also a major factor in causing stomach cancer. The inflammation it causes continuously damages the cells of the stomach lining. Signaling inside the cells gets disrupted, and when you add unhealthy lifestyle habits that constantly irritate the stomach lining, if certain signaling pathways happen to get activated, you end up with abnormal cell proliferation. Over time, what starts as simple gastritis can gradually develop into deadly stomach cancer. The good news is that not all H. pylori bacteria can secrete the CagA and VacA toxins. The ones that can produce these two toxins are known as type 1 strains. They're highly toxic and very harmful, and are closely linked to gastritis, stomach ulcers, and stomach cancer. Those that don't produce these toxins are called type 2 strains. They are less toxic, and their ability to cause disease is relatively weaker. The bad news is for adults, whether you're infected with type 1 or type 2 H. pylori, eradication is recommended. This is because as long as H. pylori is present, regardless of whether it's type 1 or type 2, it will cause damage to our stomach lining. The only difference is the degree of damage. An expert consensus on the prevention, control, and management of H. pylori infection in Chinese households points out that, for all adults infected with H. pylori, eradication of the bacteria should be considered. For the elderly and for children, however, a more cautious assessment is needed. Children have unique developmental needs, so indications for treatment and antibiotic dosages must be strictly evaluated. The elderly often have various underlying health conditions, so drug interactions must be considered, as well as the ultimate benefit. For these groups, the benefits and risks of treatment need to be assessed on an individual basis. It's not a one-size-fits-all situation. But for adults, whether you have symptoms or not, eradicating H. pylori is still the most effective method for preventing stomach cancer. The earlier you eradicate it, the greater the benefits. Currently, the mainstream treatment plans are quadruple therapy and high-dose dual therapy. Quadruple therapy means using 2 types of antibiotics, plus a proton pump inhibitor and a bismuth agent, which protect the stomach lining and help the antibiotics work better. You usually need to take it for 14 days. The eradication rate is over 80%. High-dose dual therapy, on the other hand, involves high doses of just 2 drugs for eradication. Usually, it's the antibiotic amoxicillin and a type of proton pump inhibitor. The reason for using a proton pump inhibitor is because amoxicillin is a drug that kills bacteria during their reproductive phase, and it's easily destroyed in an acidic environment. Proton pump inhibitors can effectively suppress stomach acid, raising the stomach's pH value. This puts H. pylori into an active growth phase, allowing the amoxicillin to fully sterilize them. Both therapies are equally effective, and both are recommended in China's H. pylori infection treatment guidelines. Just follow your doctor's advice on which plan is right for your situation. But, and this is a big but, unless there are special circumstances, do not stop taking the medicine. You have to strictly follow the dosage and timing. and take it continuously. Otherwise, stopping and starting is basically giving the bacteria resistance training. And the more resistant they get, the harder they are to eradicate. We know many people with H. pylori are afraid to get treatment because they worry it'll come back after they're cured. Actually, after a successful eradication, the annual reinfection rate is very low, less than 2%. Some patients who say they've had a relapse actually just took their medication inconsistently, which means the bacteria were never successfully eradicated in the first place. Of course, food hygiene and the habit of sharing meals are also closely related to the relapse rate. Then there are some folks who might have heard that H. pylori can lower the risk of asthma, which means the bacteria were never successfully eradicated in the first place. Of course, food hygiene and the habit of sharing meals are also closely related to the relapse rate. Also, some of you may have heard that H. pylori can lower the risk of developing asthma. Claims about the risk of diseases like eczema. Cases like this do exist, but right now the sample size is very small, and the evidence is pretty weak. For adults currently infected with H. pylori, the recommendation is still to eradicate it. H. pylori is not a probiotic. That's the general consensus in the medical community. So, how can we tell if we're infected? With H. pylori, the internationally recognized gold standard is the breath test. Maybe a lot of you have already taken this test. You need to have an empty stomach for the test, and you'll drink a urea solution marked with carbon-13 or carbon-14. After a short rest, you just blow into a special bag to complete the test. The principle behind it is also quite simple. If H. pylori is present in our stomach, then its urease enzyme will break down the urea and produce carbon dioxide. By measuring the concentration of carbon dioxide containing carbon-13 or carbon-14 in your exhaled breath, we can tell if H. pylori is in your stomach. It's important to note the carbon-13 test can be used for everyone, while the carbon-14 one has a trace amount of radioactivity, so it's only recommended for non-pregnant adults. The accuracy of both tests is over 97%. If someone in your family is infected with H. pylori, or if you have a family history of stomach cancer, and you start having symptoms of indigestion, like bloating, acid reflux, bad breath, or stomach pain, you should see a doctor to check for a possible H. pylori infection. Finally, there are two more things I need to remind everyone about. First, although the probability of adults getting infected with H. pylori is much lower than for children, but there's still a chance of getting infected. So even if the eradication is successful, we still need to try our best to use separate dishes and serving utensils, wash our hands more often, especially before meals and after using the restroom, and avoid sharing toothbrushes and rinse cups. Second, if you or your parents meet the following criteria, it is highly recommended that you get an endoscopy screening. An endoscopy might be a bit uncomfortable, but it's truly one of the few methods that can detect cancer in its earliest stages. And the earlier a problem is found, the higher the chance of curing the stomach cancer. Completely eradicating Helicobacter pylori, popularizing endoscopy screenings for high-risk groups, and having everyone switch from family-style meals to individual servings. At first glance, none of these seem easy to achieve. But for us as a people, is this the first time we've faced something difficult? We may not be able to change our environment overnight, but we are also changing it at every moment. Who knows, maybe our children will be able to live in an age where stomach cancer is a rare disease. All right, that's all for this video. If you found this useful or even a little bit helpful, feel free to follow us. That way you can learn more about medicine